Hey everyone, welcome back to CBH Pavai, my channel. Today, we're tackling a topic that's close to my heart, breast cancer treatment. You know, as someone who's spent years dealing with skin conditions, I've learned that knowledge is power. Whether you're seeking information for yourself, a loved one, or just want to be informed, this video is here to help. It's all about arming yourself with the facts, just like when you're dealing with a stubborn cyst. Let's dive into the different treatment options available for breast cancer. We're going to break it down step by step so you can really understand what's going on. All right, let's start with surgery, often the first line of defense against breast cancer. Think of it like removing a cyst or a lipoma, but obviously this is much more serious. The two main types of breast cancer surgery are lumpectomy and mastectomy. A lumpectomy is like a precise extraction. Surgeons remove the tumor and a little bit of surrounding tissue, kind of like creating a safe margin around a suspicious mole. Now, a mastectomy is a more extensive procedure. It involves removing the entire breast and sometimes even nearby lymph nodes. There are different types of mastectomies, some removing just the breast tissue and others removing more. It all depends on the individual case. The decision of whether to have a lumpectomy or a mastectomy depends on a variety of factors, like the size and location of the tumor, whether it's spread to nearby lymph nodes, and of course, the patient's preferences. Surgery is often just the first step in a comprehensive treatment plan. It's like when I remove a large cyst. Sometimes we need to do a little more to make sure it doesn't come back. After surgery, your doctor might recommend additional treatments like radiation or chemotherapy to ensure that all those pesky cancer cells are gone for good. It's all about being thorough, just like when I'm making sure I've gotten every last bit of a blackhead. Remember, every case is unique. What works for one person might not be the best approach for another. That's why it's crucial to have open and honest conversations with your doctor. They'll help you navigate this journey and make the best decisions for your health. Next up, we're talking about radiation therapy. You know how we use lasers to target specific skin issues? Well, radiation therapy is similar, but instead of lasers, it uses high-energy rays to target and destroy cancer cells. Think of it like a microscopic beam, zeroing in on those rogue cells that might be lurking after surgery. It's like giving the area a powerful disinfectant just to be extra safe. Radiation therapy is often recommended after a lumpectomy to zap any remaining cancer cells in the breast tissue. It's like ensuring we've cleaned out the entire infected area, not just the visible part. It can also be used after a mastectomy if the cancer was particularly aggressive or if it had spread to the lymph nodes. It's all about minimizing the risk of those pesky cancer cells making a comeback. Now, radiation therapy does come with its own set of side effects, just like some skin treatments can cause temporary redness or irritation. You might experience fatigue, skin changes in the treated area, or even some swelling. But don't worry, these side effects are usually temporary and manageable. Your healthcare team will be there to guide you through it every step of the way. They'll provide you with ways to manage any discomfort and ensure you're healing properly. The important thing to remember is that radiation therapy is a powerful tool in the fight against breast cancer. It's like our secret weapon, targeting those microscopic enemies and giving you the best chance of a full recovery. Chapter 3. Chemotherapy, the power of systemic treatment. Let's talk about chemotherapy, often referred to as chemo. Now, chemo is like a systemic treatment, meaning it works throughout your entire body to hunt down and destroy cancer cells wherever they might be hiding. Think of it like a powerful antibiotic that goes after those nasty infections that have spread beyond the initial site. Chemo uses special drugs that are like tiny warriors, circulating through your bloodstream and taking out those rogue cancer cells. Chemotherapy can be administered before surgery to shrink a large tumor, making it easier to remove. It's like softening up a stubborn cyst before extracting it, making the whole process smoother. Chemo can also be given after surgery to reduce the risk of the cancer coming back. It's like mopping up any stray cancer cells that might have escaped the initial treatment. Now, I know chemo can sound scary, and it's true, it does come with side effects. You might experience fatigue, nausea, hair loss, or a weakened immune system. It's like your body is going through a major battle, and there might be some collateral damage. But here's the good news. There are ways to manage these side effects. Your healthcare team will work closely with you to find the best medications and strategies to alleviate any discomfort. They're like your personal pit crew, making sure you're as comfortable as possible during this race. Chapter 4. Hormone Therapy Starving Cancer of Fuel. Now let's talk about hormone therapy. This type of treatment is specifically designed for cancers that are hormone receptor positive. What does that mean? Well, it means these cancers rely on hormones like estrogen or progesterone to grow. They're like those plants that thrive on sunlight, cut off the sunlight, and they wither away. Hormone therapy works by blocking or reducing the levels of these hormones in the body, essentially starving the cancer cells of their fuel. It's like cutting off the supply lines to a factory. No more fuel, no more production. Common medications used in hormone therapy include tamoxifen and aromatase inhibitors. These medications are like specialized wrenches designed to specifically target those hormone receptors and disrupt the cancer cell's growth signals. Hormone therapy is often used after surgery or radiation to reduce the risk of the cancer returning. It's like putting up a fence around your yard after you've gotten rid of the weeds, just an extra layer of protection. Now, like any treatment, hormone therapy can have side effects. Some women experience hot flashes, vaginal dryness, or mood swings. It's like your body is adjusting to this new hormonal environment. But don't worry, these side effects are usually manageable, and your healthcare team can help you find ways to cope. The important thing to remember is that hormone therapy is a highly effective treatment for hormone receptor positive breast cancers. It's like having a secret weapon that specifically targets those types of cancer cells, giving you the best chance of staying cancer-free. Chapter 5. Targeted Therapy, Precision Medicine in Action. Finally, let's talk about targeted therapy, one of the most exciting areas of cancer treatment. You see, targeted therapies are like smart missiles, designed to hone in on specific proteins or genes that are involved in cancer cell growth. They're like those specialized tools that are perfect for a particular job, precise and effective. One example of targeted therapy is trastuzumab, also known as Herceptin. This medication is used to treat HER2-positive breast cancer, a type of cancer that grows more aggressively than others. Herceptin works by blocking the HER2 protein, which is like cutting the brakes on a speeding car. Targeted therapies are constantly evolving, with new medications being developed all the time. It's like having a team of scientists working around the clock to create even more precise and effective weapons against cancer. The beauty of targeted therapy is that it often has fewer side effects than traditional chemotherapy. Because it's so precise, it's less likely to harm healthy cells, focusing its power on those rogue cancer cells. Targeted therapy is often used in combination with other treatments like surgery, radiation, or chemotherapy to create a personalized treatment plan that's tailored to your specific type of cancer. It's like assembling a team of superheroes, each with their own unique powers to fight your battle. Outro your journey, your decisions. Every breast cancer case is unique, which means the treatment plan should be personalized. Your healthcare team will consider various factors, including the type of cancer, its stage, and your overall health, to create the best plan for you. Remember, it's important to ask questions and stay informed throughout your treatment journey. Knowledge is power, and the more you understand about your treatment options, the more confident you'll feel in making decisions about your health. Breast cancer treatment can be overwhelming, but with the right information and support, you can make empowered decisions. Remember, you're not alone in this journey. Your healthcare team, your loved ones, and a whole community of survivors are there to support you every step of the way. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. And don't forget to subscribe for more health-related content. Thanks for watching and take care.